Kathy, have you ever had to go to the hospital, the doctor's office, or anything else? You're told it's going to be one price, and then all of a sudden something's not covered. You're thousands of dollars in debt that you did not know you were going to be, and you're having a serious conversation with your first husband.
Well, I have not been seriously in debt to at that point, but I have looked at some of those bills and I find myself to be a reasonably intelligent person, but not being able to decipher what I paid for what. So I have had those issues, and I did have a strange circumstance with my child putting a bead in her ear once and being charged for realizing I was charged for a surgical procedure as opposed to tweezers in the ear. It may have been the nose. I'm not sure. So I do on a smaller scale than what you started out with.
Oh, I'm sure we have lots of stories. I know I could tell you stories as we go through this particular show. This is going to be an interesting one. I can't wait to talk about the hospital system transparency pricing and why we all can opt to make a difference at this point. I'm Stephanie Coxon,
And I'm Kathy Anderson Martin.
and we are two women inspiring real life. So let's twirl. I'm super excited. We've got Dr. Chamini Wheeler back on our program. It's been a long time, but this lady has literally been at the forefront of just, breaking, I'm going to say breaking chains. And so, Dr. Wheeler, would you just give us a little bit of your background? There's so much there. Tell us what has happened in your life right now. Tell us who you are, and let's talk about why we all need to rally behind you.
Thank you so much for this opportunity to come before your show. I just have to, so I am a pediatrician. I worked in the peds ER, and I have to say that actually one of the most unique things I've been able to take out of noses and ears have been Barbie doll shoes.
Okay.
So,
So the bead
yeah,
wasn't anything spectacular.
no, so that was, it just made me smile and how creative you have to get. And I did not realize the hospital charged that as a surgical procedure. That's very
I,
interesting
well,
I
to
would,
know,
I
you
would,
I
know.
I would like to just say here, my son decided to put a Lego arm up his nose, and we did have to have that removed, but I went to urgent care and I was not charged a surgical procedure at
well,
urgent care.
this was in the pediatrician's office, and I shared
Oh.
that as a start. It was a year we switched to like a high deductible health insurance, so we became more aware of what we were being billed. In the past, we'd get our bill and just be like, whatever, because it went to insurance. So when I got this high bill for bead removal, I went in and asked, and they said, "Oh yeah, it was a coding error. Oh yeah, we coded it as a surgical procedure." So it was like, I don't know, hundreds of dollars versus the regular office fee. So I just thought, as we go into this conversation, when it forced me to be aware, I realized that versus what would have just happened otherwise. So that's the prelude there to the bead removal, Dr. Wheeler.
Can I
I
tell you?
really appreciate that. My husband and I, he's an ER doctor, so have done those different actual procedures. But this whole thing about us, we started because we saw just the lack of physician autonomy and really the unawareness on the doctor's side and on the patient's side. And I think you said it perfectly right there that fundamental lack of awareness because you don't realize what's going on and you just kind of ignore it and go about your business. Um, so we've been in medicine for a long time. I guess in our story, we I think during COVID we really saw the lack of autonomy and the distance of the doctor-patient relationship really show its colors. And so with that, my husband and I, we have gone away from our being employed, which is what we always were, and we've opened up our own office, a direct primary care office. And so that's going really well and all of that. But the more important thing that we have got to do is to make everybody aware of what's going on and the really look at healthcare as the marketplace that it is. It is a business to take a look at that. So, yeah.
So so we're going to be talking about just us as consumers knowing the prices of things, right? I mean, I know my opening experience to that. I had a kid that fell in some gravel. I just wanted an x-ray for his hand. Nothing was punctured through, but I went into the office to have it done and they said he needs to get a tetanus, a DTaP essentially. And I'm like, "Well, why? There's no puncture wound. It was, it was just a scrape. It was bleeding. It wasn't deep. There was just nothing there." And I had said, if you guys are concerned, what about the tetanus immunoglobulin? Well, they sent in a second doctor to talk me into the DTaP, and I didn't ask for that consult, but yet I was charged for this consult. It didn't change my mind. It didn't change the outcome. I didn't ask for it, but I literally got charged 2 doctor's visits because of that. And that's when my eyes were open to what was going on. Like, why was I not given, like, that should have been told to me, like, we're going to charge you for an extra doctor's visit. Do you want to speak to another doctor about this? The answer would have been clearly no. I had already made up my mind. This is not what we needed. So, is that the kind of stuff that you see and why you're creating a movement to where we do have more control over what we're paying when we do have doctor's visits, hospital visits, and everything else?
100%. So the name of our movement is called We the Patient, with a singular patient. And the reason it's singular is because the individual matters. Everybody doesn't just go into the same shoebox. The individual matters. And with that, it's really that fundamental need to understand the marketplace so they can actually empower to navigate the care and cost that's best for them and their families. And we know that this movement is very different from any other movement, that there's a lot of different patient advocacy, things that have been wronged and trying to right and all of that. But this is a more of a healthcare marketplace literacy movement to empower individuals, every single person. If you understand the marketplace, you can ask those questions and to figure out what's best for you and your family. And that's what we need, that grassroots effort to do that.
I do think it makes, perfect sense that we know something before going into something so we can appropriately prepare for that something. So you always talk about, or at least in our conversations, you talk about something called the 4 E's. What are the 4 E's and how does that relate to the movement that you're trying to create?
I love that. So 4E, path to patient power. That is what the movement is about. So the E's are educate, empower, engage, and encourage. When we talk about educating, we want to actually educate how the healthcare system actually works, where the different, the transparency, the relationship, how insurance truly functions. We have to build a foundation of what that business looks like. We know I think a lot of times when we look at healthcare, we don't see it as a business. We just see it as, oh, it's a need and it's being met. But it is a business. So we have to understand the business behind it. And then by understanding and building that foundation, we empower each individual to use those real world the understanding to leverage their decisions on what is best for them. It truly is an individual effort for the individual patient, individual family, what they need. And that empowerment is what allows that clarity to give them confidence to navigate the system. And then once you have that confidence to navigate the system, we want to go a next step, which is to engage our individual to make the decisions, talk to their employers about the third-party administrators. How is your healthcare working? Is the employer-based healthcare that's being offered, is that what's best for all of your employees? Employee or an employer can ask these questions. It doesn't matter where you are in the healthcare marketplace. All of us are patients and we need coverage. There's all kinds of direct pay models like direct primary care and many other things that are coming. So to understand how these things fit into the broader marketplace. right now there's a sense like, oh, healthcare is so confusing because it's by design that it's meant to be confusing. So if we can educate to get that clarity, not to be confusing, it shouldn't be confusing. You pay for a service, you get the service. It should be as simple as that. But even when I talk to a like a CEO of a company, they usually, oh, I let my benefits people take care of that because it's just a nightmare. It's completely confusing. They don't understand it because it's meant to be ununderstandable and too layered. So this is to educate for clarity, to empower that. And then at the end of the day, we want to encourage one another hand in hand, doctors and patients joining together, that we can united make the change that we want in healthcare.
You mentioned the patients, and I know we all have our stories. I just recently had an experience where I think today's healthcare environment affecting the doctors as well. And I'll admit, in the past 5 years, I've changed a lot of my healthcare to a naturopathic practice, but I still have, medical doctors I need for certain things. And I was just at a physician 2 weeks ago, and I won't even say the thing. I don't want to out her. Known her for 25 years, love her. And I was talking about something, and she just kind of went on a rant. And she had a private practice sold out to a medical system. Was talking about how healthcare is so awful. You can't get the referrals. The tests are going to take forever. Doesn't, and she just went on, and it's only going to get worse. And I sat there, and while I agreed with everything she said, I felt like she was so demoralized. And she's a good doctor. I mean, I love this doctor, but I felt she is so demoralized in the environment that she's in. As while I, as a patient, feel bad, she felt bad too. And I think, is that a prevalent feeling among doctors, at least, a lot of the good ones who truly got into it for all the good reasons to help people?
I do. There's a huge movement among the doctors to regain autonomy and that decision-making process and to be the advocates and to actually care for their patients. One of the biggest things that doctors lack is time with their patients to take a history. And that just snowballs into poor care. Their patients are sick and they call to get an appointment, and the doctor doesn't even know that the patient called. Like, it's so removed from you as a doctor that their patient was sick because it goes through a huge call center in a large network that gets triage. The other day, I needed to admit a patient to the hospital, and I called the transfer center number to admit him to the hospital, and it was one of their satellite smaller hospitals is where I was going to admit the patient to, but the call center didn't even know that they had that hospital. I had to give them the address for them to find out that that was part of their network, you know.
Wow.
So when things become so big, it just becomes so depersonalized that yes, doctors are very frustrated by and large. There are doctors who are not frustrated, but I think like you're the one that you talked about who owned their own practice and then had to join the healthcare system. It really wasn't because they wanted to join. It's usually because they had to join to be financially solvent. And so that's where education comes in again as a healthcare marketplace literacy. One of the biggest things, the reason doctors had to join larger networks is the electronic medical record system. And why is that? Because of the different laws that got placed that said we needed the electronic medical to save paper, and that did that. And right now we have one medical record system called Epic that pretty much, I think they have like over 300 million patient data points with them. So, it just monopolized one industry. I mean, I think it's actually pretty funny when you look at saving paper and everybody gets an after visit summary that really says nothing.
Yes. And I don't know how you are, but I have to print everything out to read. I'm dyslexic. I can't read online. So I'm literally printing everything out anyway so that I don't make mistakes. And I can't be the only one doing that, even without
You're
dyslexia.
killing the trees, Stephanie. You're killing the trees.
I know, but I hug them and they know I love them. It's okay.
Okay. All
It's
right. That's okay then.
fine. So,
Oh,
with this, I'd also like to point out what doctor actually stands for. And really, a doctor is an educator. And I feel like that we've lost that definition somehow, some way, and that it is the doctor's responsibility to educate. It's not to create an authoritarian environment. It's not to, hide information. It's literally to educate someone. And so you're really aligning this system, this value system, with the purpose of what a doctor is. And I love that.
thank you. It is. I know in our meet and greets in our office, we say the doctor means educator, and people are very surprised by that. But that also, goes into it's the individual, the patient that has a choice to make the decision that's best for them and their family. And a doctor, you go to school, you learn all this stuff, and you can educate and give your decisions what you think would be best. But at the end of the day, it's the individual, that patient that gets to decide what is best for them. Um, but it's wonderful to be a part, this movement. It's really for everybody because at the end of the day, we're all patients and we need all hands on deck. And I looked, my husband and I, we looked online and at many other groups to see if there's another movement similar to this at all. Because if there was no need to create a movement if there was an education movement to educate patients on the healthcare marketplace. And there really isn't. There's a lot of good patient advocacy movements, cancer to different movements like that, from MS awareness to Down syndrome and all of that, so on and so forth, but not and there's even like a billing, pricing, transparency movement, but truly to kind of unravel that whole picture of a healthcare as a marketplace, educate and empower individuals to take control.
So, I'm curious. So let's just say that your ideal system is being implemented across the country, because we're just going to claim that right now. What does it look like for a patient? Like, what would a visit look like? I mean, let's just say a visit going into their regular doctor, because that's probably what most people are accustomed to. How would that visit change, and how would that feel to someone?
So it needs to change. Number one, access. The today when somebody's sick, they're not able to be seen that day or the next day. That is why we have urgent cares. Urgent cares have popped up because people don't have access to their doctor. So really, you want to go to the doctor that knows you when you're sick. So that's number one, it would look like. Then care, when we talk about what is care, care isn't just taking care of that acute illness, but it's also wellness. It's prevention of development of chronic illnesses and to promote lifestyle changes that actually takes a lot of time on the aspect of the doctor and the investment in the patients to continue to have those multiple touch points. Like I like to say, talk about, like, for example, diabetes. Um, if somebody's hemoglobin A1C is not in the pre-diabetic range, but based on their age, it's higher than it should be, that's when you should start the conversation about the changes that it needs to happen and explain why that is. And then that conversation can wait another year to be repeated at their annual physical. You repeat that again in 3 months with maybe a repeat of that hemoglobin A1C. And that allows that patient to continue to be engaged in that lifestyle choices because it gives them confidence, it gives them encouragement to keep going. I am a huge fan of like the gut biome. The gut biome health, it for me starts at the introduction of solids at 6 months. That and to talk about those conversations and prevention all of those types of things. So that's care. That's what it would look like. So access, care, and time that would be needed to have those conversations. Um,
And I think that's what you when you were with us last year and talked about, that's what's so missing. There is no doctor patient relationship. You're in there for 2 minutes with whatever. I 25 years ago, my doctor who I had for years, back to when I was a teenager, something wasn't right, and she kept seeing me. It turns out I had an atrial septal defect that had been undiagnosed for since I had been born. It was very large, which was why it made no noise, and I had to have open heart surgery to have that repaired. But I remember her saying to me, something just didn't seem right with you. So I kept sending you for tests, even though it didn't make the pain I had was not medically related. And that only happened because she had a relationship with me going back 20 years before, knew I wasn't coming in with unexplained. So she kept trying. I don't think in today's environment that would have been found because there's no they don't know you at all.
right.
And that's you talk about that a lot, that there's no relationship or time with being developed. Then that's number one, right?
It is number one. Relationship. I'm a Christian, so I believe, that we are created for a relationship, and everything fundamentally follows from a relationship, including the doctor-patient relationship. And you talked about your doctor who was, what's going on and was how frustrated she was. So in medical school, we learn that the taking a history is the most important aspect of getting to any diagnosis, and that requires time. And then, about 80% of the diagnosis is made at the history level, then the exam, and then the labs only confirm it. Um, so without the history, you really rely on not being able to, you write a script as a referral or something like that. So 100%, the time, the relationship is fundamental.
And that's probably one of the biggest complaints that I hear is just, I'm just referred to this doctor, then to the next doctor, then to the next doctor. And by the end of it, you literally have 10 different doctors. No one's cross communicating. The pharmacist is supposed to be checking to make sure there's no contraindications. And then you end up on all these meds because no other doctor is willing to take you off the first med that the first doctor put you on. And it just seems so disconjointed for the average person who's truly trying to seek, because clearly there's something wrong if you're being referred everywhere, but it's just disconjointed for them and they're not getting the answers because it's not there. We have to go to break, but you are such a warrior, and this is just the beginning of the story of what's happening. So let's talk about the next phase of your ingenious plan after the commercials. America Out Loud Talk Radio plays an iHeartRadio network. You can also listen on the media player from any web browser anywhere in the world. We have the best in-class apps available on Apple, Android, and Alexa, where we stream 24/7. You can find out more about our show and get all the latest podcasts if you go to the menu nav bar at americaoutloud.news under our shows or schedule. Then you'll be in the know. So one of the things that I absolutely adore about you is that not only do you see a problem, but you are a solution finder. And I'm pretty sure that nothing holds you back. I've never seen anything like it before in my life. If it's, as if the average person would say it's impossible, you just kind of, put your nose up at it and keep going. And I believe the same is true in this case. So you're not just talking about a problem that you see, but you are actually taking steps towards a solution. There is a bill being introduced in the state of Pennsylvania. Can you tell us a little bit about your steps towards that, how you got there, and what is happening?
Thank you for the time to talk about this. So it's called the Patient's Right to Understand Act. And it's really that we as individuals, as patients, need to be able to understand what this means. And in this bill, the fundamental thing is talked about is that to understand and to be able to take action. So the three questions that we want every healthcare decision to revolve around is, do I need this? How much does it cost? And is the decision being made in the doctor-patient relationship? Can you imagine a healthcare system where those three questions are asked at every decision point and the amount of healthcare savings dollars that it would make? I have a chart here that shows the cost of healthcare literally has gone from 17% in 1990 to 36% in 2020. It was 719 billion to 4,124 billion is our healthcare marketplace, according to Peter G. Peterson Foundation in the United States. Um,
Wow.
so, so the right to understand that in order to engage patients at that grassroots, it's like we have to do this. Our country is going to go bankrupt if we don't take care of healthcare. Like it's not an if, it will happen. Um, Dr. Marty Makary, who's a FDA director, he published this article in USA Today a couple years ago. And in that, it talked about how about 48% of our United States budget is spent on healthcare. It's
What?
unbelievable. Yes. So when you look at it, 15% on Medicare, 10% on Medicaid, so that's 25%. But did you know that about 12% of Social Security ends up going towards healthcare because our seniors, that's what they pay for their Advantage plans, their medications, their deductibles. So even their Social Security income, about 12%. Then our defense system, about 2.5% goes into from the defense budget into the healthcare system. The non-discretionary spending, 4.4% goes to that. And and then other 1.2% federal employee benefits. And even 3%, our national debt is interest is 6%, and 3% of that goes to healthcare. So when we add all that together, that's 48%. It's going to go bankrupt. So patients' right to understand this system before we become bankrupt is what we have got to do.
And this whole thing, there's nothing like it. As you were talking, I mean, I'm thinking I've been having an appliance installed. I have a bill that shows what I paid for the appliance, what the installation fee will be. If I want a warranty, this is what it is. If I go buy a car, it's itemized out. This is what the car is, even the packages of options on the car. If I want an extended warranty, taxes and tags. This is the only industry where you have no idea what you're paying for when you receive it. And that's the whole point that I mean, along with this is not a political issue. It is a patient, as you say, the patient, right, that we should be able to discern what exactly we're paying for, what the insurer is paying for on our behalf. I mean, that it's basics. I mean, it's just so simple. And why? Why is it like that?
It is. And even our employers employers in our nation is who pays most of our healthcare, right? Because they pay for their employees. And our employers can get the information themselves. These data points and all of this, it's all just kind of, oh, it is just the way it is. No, it's not. We need to
It
change
doesn't.
it.
And that's what you're doing with your group to try to change the transparency, and put this back in the hands of the patient, the people that are receiving the care.
100%.
So, I mean, so the bill is written, it's being introduced. Do you have a bill number for this by chance?
We don't. So it's in its revisions. So it hasn't been introduced completely yet, but our goal is to get it introduced.
So, is
It-
there a plan, a launch date, anything like that that could be happening?
yes. So April 20th, 2026. So just about 63 days away, I think. is at 10 o'clock in the morning. We're going to have a press conference and a release of what this bill means, what it means for the individual. And we need all hands on deck for this change to happen. It's it's not it's not a political bill. It's an individual bill for every patient. Every one of us needs it. And if you and it's going to happen at the state capitol. We're going to launch the movement.
Well,
And with it,
The Pennsylvania state capitol. Although we
yes,
are, I'm assuming that we're all hoping that this spreads like wildfire across the U.S. It starts somewhere,
yeah,
RFK launched the Eat Real Food campaign from our state capitol. You are launching this from our state capitol in hopes that every American can have full transparency and be able to have that doctor-patient relationship, right?
yes,
That's
it
also,
is.
but
It is.
anyone's welcome to come to your launch.
Yes.
Just to show the support, get people behind it, and tell people that you are tired of not knowing what you're walking into. Because what in this world can we do that with where it makes sense? We all need to know to make good decisions what is happening, and you can't make those without complete transparency.
That's what I keep sitting here thinking. If I walked to get a car and they said it's $52,000, and I would be like, okay, what does, and they said it's just $52,000. Oh, okay, I'll write the check. No one would do that.
No one does that. That's
No.
right. Oh, see, this is.
Dr. Wheeler, you mentioned launching this April 20th at the Pennsylvania State Capitol. I think you said 10 a.m. Is that
Yes.
correct?
10 a.m.
Uh, is there are there similar efforts in other states, or is this like the testing point to have it spread through the country?
This is this testing point to spread through the country. The the more individuals that really understand it, share this information with your groups, your local groups, your individuals, and get people engaged. The really we can make our access meaningful. Care can become coordinated, all of those things. And really, one of the things I didn't mention is I have this visual of a circle of trust. What does that mean?
I
We talk about the fundamentalist, the relationship, and because there's lack of transparency and people don't know what they're paying for and they don't have access, care, time, transparency, trust is really eroded. So getting that access, we envision a healthcare marketplace in our nation where people have access, care, time, transparency, and that will complete that circle of trust. And that circle of trust, you talked about how the doctors are frustrated on one side and patients are frustrated on the other side. And by doing this, we really are coming together hand in hand, completing that circle.
I'm
And
not
trust
gonna
will be
lie.
restored.
I missed everything you said because all I could think of is Meet the Fockers and his circle of trust. I may need you to repeat this to me later on, or I'm gonna have to rewind and
Yeah,
listen to
not
this.
not not now, not
No,
now, Stephanie.
no. But I'm like, oh, the circle of trust, like in the family. Yeah. So, yeah. So my
I
mind went
forgot
elsewhere.
about that.
Yes. Yes.
Yeah,
So
but that's a great calling it that, the circle of trust, because if you look at surveys and national opinions about healthcare, it's at all-time lows of people having faith and trust in our healthcare system. And I think back to when I was a kid or growing up, if the doctor said do this, you did it. You didn't even think to question. And now that trust, I think, has been eroded for a lot of reasons. But that's very important to kind of get that back.
I
Right.
completely agree. I
And the
mean,
only way it can come back is by building the relationship.
and I want to point out to anyone that's listening in a different state and being like, I wish we had our own Dr. Wheeler, because I wish that for your state. This is a bill that you can take and introduce to your own legislators. So you can, copy bills. That happens all the time in the US. And this is an opportunity for people to kind of replicate in their own states, to advocate for themselves. Everyone's impacted. There's not a single person that is not impacted by this. And so I think this is probably one of the most important things that we can do to advocate for ourselves, for our children, for our grandchildren, to make sure that in the future we're not going into crazy amounts of debt for healthcare that we don't understand.
Uh, it's health and it's economic. Dr. Wheeler, you said it earlier. It's economically unsustainable with that kind of increase that more than 30% of our economic uh, picture in the country is going to these healthcare costs and then having no idea what the deliverables or what the result is. And there's so many levels where this is a problem. And how can people help you get this message out other than by you sharing it like on this show and else? I mean, how can people help share this?
So the biggest way to help share it is to go on our website. It's wethepatient.net, and it's patient singular, because the individual matters, and .net because we're creating a network of patients. So I'm hoping that everybody can remember the website very easily with that. And then so share that. And on our website, we have there's join the movement. That's just a fundamental level. We're trying, honestly, there's on there to be able to gather like by zip code, by county for the state of Pennsylvania. So we can actually have town halls or events at those areas to have this discussion, because this is about all hands on deck and just having a discussion and, doing that 4E path to patient power. The next level would be to volunteer. We need volunteers. We can't do this just with a few. We need the more engagement, and there's all kinds of levels of volunteer, from being on a street team, meaning that you, as a street team volunteer, you just take responsibility. You know what? This information just got shared in a blog. I'm going to get it to my peeps, my circle of influence that I have, and I'm going to get it out there. That's what a street team would be. And there's other levels like that to do too. And then we would love for everybody to come and attend the launch, where actually you can get a free t-shirt for We the Patient is our goal. We need money. We need donations to make these things happen and to get it out on all the different venues of social media, to all kinds of different places, to have events and to produce literature to get this movement going. I would love to have billboards to empower people, so all of those things
So,
are the
so
ways to do it.
it's a multi-front approach. A groundswell of just people, as you said, the patient. I mean, that's all of us.
Yes.
Physicians as well, who are disgruntled with the way things are and want to go back to that relationship, care-centered approach versus whatever we have now. And then also the political realm. So are you actually visiting with representatives and senators and so forth to make them aware of this opportunity of how they can help people in their charge, in their communities?
Yes, 100%. That, because we need all hands on deck. It cannot be just one side. So, it's not, so anybody who's listening to this, and, we're asking you to go to your local senator and representative. We're not saying this is not political. So it's Democrats and Republicans. Go to your local representative, your constituent who represents you, and
Right.
ask them to co-sponsor this bill. Wouldn't it be great that we could get our Pennsylvania legislature to everybody to sponsor the bill? I mean, I know that's a tall order, but this is for every individual. It's really to learn the system, to understand it. This is not anything at all that should be a hard thing to get behind from either side. We're just asking to understand.
Transparency.
Exactly.
Transparency and and education.
Right. And in unity, there's strength. So this, and I think that's what's so beautiful about our nation is we the people, right? So this is we the patient. It really is a grounds up approach to transform it so we retake back autonomy in healthcare.
So is this anti-insurance or anti-hospital? How does this kind of work into our current system of where we're at?
So I think that's a great question. So no, this is not anti-insurance or anti-hospital. This is pro-patient and pro-clarity. So it is gonna asking when somebody goes to have a service to know what that looks like, what that price point would be. And so it's 100%, I think it is often can maybe get viewed at, oh, well, this is another thing that hospitals or insurance have to do. But it is for the right of a patient to know what you're paying for. And so it is not against hospitals and insurance, but it is in its at its essence, in its root, just transparency and trust.
I do want to
Correct.
know if this would give me the opportunity to say no to that second doctor consult that I had to be billed for. Just I want to go back to
Yes,
my original
absolutely.
problem.
Well, I was
Absolutely.
thinking of something even more ridiculous, and this happened, and this was even years ago. I went in for something, I don't know, and I had had a cyst on my neck before. So I said I was in for something, I don't even remember what, but I said, "Hey, could you look at this little bump while I'm here? Because is there another one of these cysts for me?" And the doctor said, "No, I can't look at it." And I said, "What do you mean you can't look at it? We're sitting right here, you know?" And she said, "No, you have to schedule another appointment because it's how it's billed." I mean, that, like your thing, Stephanie, I that doesn't to me benefit anybody. That
Correct.
doesn't benefit me as the patient. It doesn't benefit the doctor who already has a loaded schedule in 3 minutes. Literally, that could have been done with a minute, 30 seconds versus calling the call center, rescheduling, coming back in, doing another billable. But that's the kind of system that we're in. And I think when you mention that, Dr. Wheeler, it can be that absurd. And that,
It,
again, that doesn't help the insurer, it doesn't help no one.
No, it doesn't. And that really, this is where the education for our movement comes in because it's really based on a billing code. The doctor needs to be able to get paid, and so it's a generation of a billing code, and that one visit gets that billing code. So the next, then in order to have financial liability, you have another billing code for taking a looking at the cyst. But that also has the rippling down effect in that now you're going to take another patient slot.
Right.
And so now you just limited the availability of patient slots. And now you don't have access even more. And now you have to go to the urgent care or the ER for that cyst or something
Right.
minor that generates more revenue because those are higher charges. And since that person who sees you at that urgent care or that ER doesn't have a relationship with you and doesn't know you, they might actually run more testing and more referrals than the doctor who knew you who would have just said, yeah, just do this and come back. So the whole thing is convoluted in its setup, and we have got to educate, empower, engage, and encourage one another. And I really do think we can have this vision of this healthcare marketplace that patients have access, care, time, transparency, and trust.
I don't, and this, again, this is not a political issue. I think if you did a survey of most Americans, I shared some personal stories. Stephanie, you shared one. This is not, I mean,
I shared
almost
two,
everybody.
Kathy, two.
Yes. Yes. Sorry, Stephanie. These are not issues that are unique to just Stephanie and I. This is an issue that affects, you can almost have everybody will tell their story of not receiving care, as you mentioned, Dr. Wheeler, not being able to get in to see their doctor, insurance issues with billing issues, and all of those things. Increasing costs. I mean, it's everything, and it affects everybody. So that's why it behooves everybody to listen to this.
It's funny. I was thinking about that. I can't think of a single person that would not benefit from this bill, not only in Pennsylvania, but spreading across the country. We all need this bill. It's the right thing to do, honestly, because
I
it's like you said, we don't walk into any other place blind. We don't do that.
Have you
We
have
don't
you
even do it with
received?
car insurance,
No,
right? We go get
opposition.
estimates.
Oh, and you get a line item, I paid
Yes,
$20 more for this and 10 more for liability
right.
and support. Have
And
you been,
what's really beautiful about this bill actually says, that it needs to be in plain language, and the language cannot be buried in like 40 pages. It needs to be like in 2 pages so you can read and understand it. Because it's really just a financial transaction per service that you're getting, right? So it shouldn't be so complicated.
have you gotten any resistance to this?
So it hasn't been introduced yet. So it's in the process of it.
Can I just say real
So
quickly before you continue, guys, this is breaking news on the Twirl Show. Just people need to know that we are breaking this whole thing out into the open.
We're probably going to be lauded for all of our efforts on this with
Yes,
Dr. Wheeler. We're pretty
yes,
much her partners.
yes,
Yes.
yes. We
Okay.
we this is the it moment right here. Okay,
the
continue.
no, so I haven't seen the resistance come up specifically. Um, I do fear that we might have resistance because the financial incentives that are built in to the system, because I mean, this system is there to make a profit, and the profit is keeping it convoluted and not transparent and not to understand, so it's too confusing, and it works because healthcare is a need, right? When you're sick, it's not something you can say, well, I'll come back to buy that sweater next week, and when I understand what the cost of the sweater will be, right?
Right.
Um,
Right.
you're sick, so they have you, and our patients, like, they can't deny care. They can deny something because they need it. So that's why I think this is the only industry that you can make this business model work. No other business could do this and make it work because you can always delay it until you understand it.
When our daughter had open heart surgery at age 2, because she had a ventricular septal defect that needed repaired, I have that bill from the hospital, and that was 25 years ago, 20 years ago plus, in my bill box, where I put my bills to pay my bills, just to always remember it sits there to think, this is how much worse it can be, because
Yeah.
your health is everything. And so it's just that reminder when I get irritated about paying bills, I could have this bill and even worse, a child with extremely compromised health. So your health is everything, and access to care is number one,
Yeah.
proper care.
So tell us what is wethepatient.net. What, you just remind everyone how can they get involved in this? I mean, it's showing up. So remind us of the date and the time. Just kind of give us the lowdown here as we wrap up the
Sure.
show.
So April 20th at 10 o'clock in the morning at the Pennsylvania State Capitol. Show up and you'll get a t-shirt, and you'll get to hear the launching of Patients' Right to Understand Act, and what that all entails. It will be just a wonderful time of encouragement and unity and empowerment for us. We will talk about our mission, the 4E Path to Patient Power, which is to educate, empower, engage, and encourage one another. And the vision that we hope to accomplish, which I know is possible by this movement, is a healthcare marketplace where each individual, each of us as patients, have access, care, time, transparency, and trust. And so to get involved, on the website, join the movement. We need you to volunteer at all different levels that you can. And we would love for you to, reach into those businesses that your own pocketbooks, to see and pray about it at the level of donation that you can do, because all of this, need money, and we would love for your donations to make
And
this a reality.
And get that free t-shirt because then you can have a whole army of walking billboards.
That's
Yes.
right. That's right.
And
100%.
they're really really nice looking t-shirts. I think you
That's all.
will
I'm
really
in.
like
I'm in. You had me at t-shirt. You had me a free t-shirt.
Thank you so much for coming on, Dr. Wheeler. That was absolutely amazing. Kathy, I think this could be a historical moment in US history where she is literally having a launch point of something that could just, totally change our entire system across the country. And for every person's sake, I really hope that that's the case and that I'm right. I think I am right. I just want to say, and I just want it to be in the history books that this show was the beginning point for it because,
It, I,
this is our first
I
breaking news.
yes, I fear when there's money involved in financial incentives, there'll be pushback, but there shouldn't be because it's about transparency, economics, and health,
Yes.
period.
And there's more of us than there are of them. We are the ants.
Then we we have to do go, and the ant has to go about the work.
Yes, the ant has to go about the work. This is work that can benefit every single person. Like literally, there's no one unless you're living in like a mountainside where you've never
You,
stepped off your own property, you
you
know.
know, my interaction with my physician was demoralizing, but now it's actually empowering because I feel that there are a lot of really good people, even in the healthcare system, nurses, doctors, medical providers who agree with Dr. Wheeler. It's just getting them to have the courage to stand up with her and make a change.
Absolutely. I completely agree with that. I think that it's hard to be that voice that stands out. She's the leader in this, and I hope that other doctors come behind her and say, yes, we see the same problem, that our goal is to help our patients. And I think, when a doctor goes to school, that's really what they're thinking. They're there to help their patients. I don't know that any doctor goes into medicine with a thought otherwise. And it's
Right.
just bringing back that initial intention and saying, you know what, this is a possibility, this is real. It's just having that courage to say enough is enough, that I'm willing to make a change. I'm willing to put myself in an uncomfortable situation, perhaps, in order to make this change. But literally, I mean, there's not a lot out there that really does impact every single person. And this
And
isn't
this does.
that.
This does.
This truly does. And just the intention. And I love the circle of trust. I know I made fun of it with Meet the Fockers, but I do love the circle of
Stop that.
trust.
Stop saying that.
I can't help it. I mean, it's probably the only movie line in
But
in my life that I know.
it goes with what we're seeing in the media where people have lost that trust and it's been going downhill for the past few years. And it's time to change that. And it's what she said, it starts with relationship. Every single thing in life is about relationships, number one.
Yep.
So, and your healthcare provider should be at the forefront of that.
Yes. And kind of like our show last week where there's a money aspect to all of this. This costs
Oh,
money.
always, always.
This is another incredible cause where literally all of your money is going towards the movement that you can make a difference truly and how important it is, even if it's $1 that you donate. It doesn't matter the
And,
amount, but it's going to
and if
make a
you're in
difference.
Pennsylvania, show up on April 20th at the
Yes,
Capitol, 10 a.m.
make the drive in, show up so that you can speak out. And just like we say every single week, wherever you are, to the extent that you are able, stand up, step forward, and speak out, especially on April 20th.